What makes a world-class simulation center truly successful? Sure, technology matters, curriculum design matters, faculty development definitely matters, but there's one ingredient that underpins it all: financial management. Hi, I'm Dr. Paul Phrampus, the director of the Winter Institute for Simulation, Education, and Research at the University of Pittsburgh and the UPMC Health System. Many of you know us as WISER. When we think of simulation centers, we often jump to the exciting stuff: mannequins, AR, VR, computer equipment, AV systems, standardized patients, and lots of innovation. But behind every successful simulation story is a sustainable financial strategy. Let's talk about some things that's overlooked in simulation education, but absolutely essential for long-term success: financial management associated with simulation centers. Some would view it as the less sexy side of simulation, but I argue having a significant understanding of it is critically important for the success of your center. The intention of this video is to introduce some basic terms and topics. Whether you're just starting out or managing an established center, understanding the financial side of simulation is more than just keeping the lights on. It's about creating a sustainable program that aligns with your mission and can grow with your institution needs. So let's get started with the basic concept: budgeting. Simulation centers typically deal with two kinds of budgets: startup budgets, which include big ticket items like facility renovations or maybe even building a new building; AV systems, and maybe your initial purchases of your fleet of high-fidelity, high-cost simulators. Secondly, operational budgets, which cover your ongoing costs: staff salaries, simulator maintenance, disposable supplies, utilities, and even coffee for your staff and standardized patients. Both are crucial and both require careful planning. Now let's break down a few more important categories that anyone managing a center should understand, especially if you're not coming from a business or a finance background. Fixed costs are those that don't change much month to month. Think rent, salaries, for the most part. Software subscriptions, extended warranties, and things like this. Stepwise variable costs, or step costs, are another consideration. These are things that have a big impact on the budget related to hitting a certain threshold of activity. For example, as mentioned previously, salaries are generally considered fixed costs. However, if you take on several new large projects during the year, you might need to add a team member or two. That will cause a significant increase in the fixed costs associated with salaries, but is directly linked and dependent upon your increase in your programmatic offerings. Variable costs, on the other hand, depend on usage. If you run more simulations, you spend more money on consumables like IV tubing, gloves, moulage supplies, etc. Then another category that's important to understand is capital expenses. Capital expenses are major purchases: mannequins, ultrasound machines, AV systems, typically purchased once and used over many years. This brings up needing to have a basic understanding of the accounting principle of depreciation and how it can help understand how your organization is going to want to account for the expenditure over time. Think of it this way. If I buy a $100,000 simulator today and I imagine it will last for 5 years, how do I use it up from a financial cost perspective so the budget stays more stable over time and reflects that a simulator will devalue over time? Conceptually, it's like recognizing that if you buy a brand new car in 1 year, truly reflecting the value over the time of the purchase, it would need to be spread over the life of the car. Lastly, understanding the relationship between capital purchases and the impact on the operational budget is often overlooked. This is an important consideration. Another example: when making a major one-time purchase of $100,000, an expensive simulator, and just when you thought the money was gone and you got it all taken care of, now you need to go back and add $30,000 a year to your fixed expense operational budget to be able to afford the extended warranties. Consumables, on the other hand, are single-use or short-term items that can need regular replacement. Understanding these categories help you forecast, plan purchases, and explain where the money goes when someone from finance inevitably asks. Additionally, understanding the operational fixed and variable expenses, including the depreciation of your major expenses or capital purchases, can greatly assist you in forecasting the future, as well as developing a deep understanding of the cost of each program or activity that your center embarks upon. And here's where things get a little tricky. Many simulation leaders are expert educators, oftentimes clinicians or former clinicians, but have never been formally trained in managing budgets or developing pricing structures for services, understanding accounting and finance principles, which you need to have an understanding of, not necessarily develop expertise in, but have a great understanding of, so that you can talk finance and you can talk accounting to the people in your institution that will be helping guide you through this endeavor. This gap in training is exactly why we developed the Essentials of Simulation Center Management course. One of the modules is dedicated to financial management, designed for simulation professionals who don't have a financial background. But even if you never take a course, I want you to think about this. If someone asks you tomorrow, how much does it cost to run 1 hour of simulation in your center? Would you know? What about how much to charge an external client? How to plan for a technology refresh in 5 years, or how to present ROI to justify your simulation-based safety training. These are real questions simulation leaders face, and they're not just financial questions. They're strategic questions tied directly to your ability to deliver high-quality education and improve patient safety. At Wiser, we've learned that simulation programs thrive when financial strategy and education mission work hand in hand. We're not saying that you have to become a CFO overnight, but if you can speak the language of budget lines, cost modeling, and value creation, your program becomes more resilient, more respective, and is likely to survive when funding gets tight. Simulation is a powerful tool, but like anything valuable, it needs to be supported, sustained, and strategically managed. If you're ready to gain that confidence or help your team better understand the financial side of simulation, we invite you to explore our upcoming new online course, Essentials of Simulation Center Management. In the financial management module, we will provide real-world examples, downloadable templates, and easy-to-follow frameworks that can help you build or strengthen your simulation center's financial foundation. And even if the course isn't right for you today, I hope this video has given you something to think about and maybe a few terms to bring into your next budget meeting. If you found this helpful, feel free to share it with a colleague or subscribe for more content on simulation, education, leadership, operations, curriculum development, and all things Sims. Because simulation doesn't just save lives, it deserves to be run like a vital part of the healthcare system. Thanks for watching, and until next time, happy simulating.